Hey everyone, follow my weekly series of frequently asked questions that patients send me. And the question of this week is, what will my breast feel like after a breast augmentation? And that answer really depends on multiple things. I would say, how tight your breasts are already naturally. The size of the implant is a component of that. The laxity of the soft tissue over the implant. And probably the biggest thing is how much breast fat or how much breast tissue is over the implant. So I'll give you the extreme version of both. So, extreme version of very tight, firm breast is someone who's very young, who doesn't have a lot of breast fat or body fat on them. And with the augmentation, it's really just depending on the implant itself. And so, the implant, there's really a limit to how much you can put in someone like that, as far as how tight they are. The implant goes in, and afterwards, over 6 months, the breast's gonna be softer. It's gonna be, it's gonna feel a little bit firmer. There's not gonna be a whole lot of, sagging or anything like this. It's gonna be right there. On the extreme version, you have someone a little bit, heavier, and it's both the breast tissue and just fatty tissue. Has a little bit more of a laxity to the breast tissue as far as this kind of a little, not really a droop, but more of a natural appearance. So you have a little more soft tissue associated to the breast. The implant goes in, and then typically it just kind of becomes something like just a fuller, softer breast because there's a lot of soft tissue hiding the implant. In both cases, the implants are going to be most likely a silicone product, and it's designed for softness and feel, and it gives you a better form. So in the event, most women are in between the two. I would say most women enjoy augmentation. It's one of the most high satisfaction rate procedures that we do as plastic surgeons. And if you have a faulty implant, go visit your local plastic surgeon. All right, thanks for following. See you next week.